15 signs that a man is infertile. We are going to be discussing the signs and symptoms of infertility in a man. Remember our last video, we were talking about the causes of infertility in the man. Now let's look at the signs. Because if you are vigilant, if you are observant enough, you are able to suspect a man. And this is the basis for which you would think of advising somebody to go to the hospital. So he can see the doctor, he can see the specialist, and some investigations can be made. We have seen situations where a man and women live together, a man and a woman, and there are glaring signs that this man is not productive, that this man is not fertile, that this man cannot get a woman pregnant, and the woman is just there, and the man, and with the man, we are going to be looking at the signs and symptoms, because what you see and what even the man feels with, something you feel, but another person cannot see, is a symptom. But if that thing is glaring that another person can see with the eye, it is a sign. So we are discussing the signs and symptoms of infertility in the man. We are targeting the men for within this period, and we will soon go back to women. But we shall be looking at the reproductive health of both the man and the woman. When you have a comment, please, we welcome it, because it will help us to do more research and share. Remember, I have devoted myself to serve the world free of charge. Maybe the little thing you may spend is your data. You can always, activate some mobile data so that you watch our videos on this channel. You will be blessed. There's coming a time when we will be needing your help. But if you can provide it now, no problem. Very good. Because it will encourage us to get more gadgets that can produce more quality videos. And we keep the learning going. Sometimes don't even mind. Your contribution may look small, but may be very great to promote this course online. Thank you. My name is Dr. David Ayim. I am a reproductive health expert. Of course, I am a midwife. I don't know why I always introduce myself, forgetting the fact that I am a midwife. Even though a lot of people do not know that a man can be called midwife. No. All of it is a midwife. Any person that has specialized in midwifery, that is a term, okay? You go to school and study and specialize on care, rendering care to those that are pregnant. Mother and childhood care. If you study the arts and science of caring for somebody who is pregnant, during pregnancy, during labor, and in the postpartum, caring for the mother and the baby, then you are a midwife. That is who I am. Because I'm specialized in reproductive health / midwifery, then I hold a PhD in public health. Subscribe to this channel, and I assure you, we are going to learn. We are going to learn. You can propose other topics. I acknowledge the fact that some people have proposed other topics, especially when I talked on the reasons why a man should have sexual intercourse more regularly. And a lot of people have proposed other topics. I am taking note. We will be coming up with the answers and putting them in small videos. Feel free to even criticize. Criticism is necessary because it helps to build and provoke more research for deeper studies so we can grow. Now let's come to the topic. Signs of infertility in the man. I will give you 15. 1. difficulty in ejaculation. Some men may remain on a woman during sexual intercourse until they are sweating, they are tired, until the woman is begging that, beg, calm down, and the man is not ejaculating. Do you know that the longer a man stays on a woman after intromission is from the time penis has entered vagina, if you time it, deeper studies have proven that very healthy men would ejaculate between 4 minutes to 8 minutes. And you begin to find somebody after it penetrates, 10 minutes is still there, 12 minutes is still there, 15 minutes is still there. My dear brother, question mark. Are you very fertile? Do you think you can get a woman pregnant? Because if there were healthy sperms anywhere on your track from your testes, once sperms are healthy and active, it just needs stimulation, a bit of friction as you penetrate the vagina. 4 minutes, 5 minutes, 6 minutes of ejaculated, just quality. If it starts going longer than that, there is a question mark. Number 2, small volumes of ejaculate or ejaculation. Some people may even remain on sex on the woman, and at the end they just discharge some small fluid like that. It just comes out like small drop. What is that? 1 mil, 1.5 mil, 2 mil. Oh la la. Well, it's better to be 2 mil, at least within some range, getting closer to normal range. But is it every man who after sex, what he ejaculates, what he discharges, is it up to 1 mil? Is it even up to 0.5 mil in some people? Sometimes it just at the end, after all that stress, it's just some small air. You doubt where the air is coming from, where it's supposed to be fluid, semen. Question marks are, if you always discharge and your discharge is small, woman, wash the back of your husband. Then you people will make a happy family. That is even the reason why 2 of you are together. You watch my back, I watch your back. That is why I'm discussing signs and symptoms. You, the man, there are some signs you feel. Discuss them with your wife, because a good wife will certainly feel for you and may propose better solutions. Thank you. Number 3, reduce sexual desire. You find a man, he has lost interest in sex. He doesn't even have time. Sometimes the woman will try, touch him up and down, touch. He will give from one excuse to the other. It looks like the desire, the feeling, even to have sex is never even there. Number 4, difficulty maintaining erection. Some people may really like to have sex. And sometimes you find even a woman saying it, that I pity my husband, I pity my man, I pity my partner. He really loves to have sex, but he's struggling. When the penis even gets erect, before you know it, it falls. Even when you try every other way, try to erect, before you know it, some people will even come and complain to us that my husband, he will just have erection. And then you are forcing it to fasten inside your vagina. And then as you're trying to fasten it, it falls. It's okay. Asha. There's need for you to meet the doctor. There's need for you to go to the hospital. That's a sign. Okay? You see it. Number 5, pain upon ejaculation. Some men may have sex. By the time that small fluid comes out, this one really looks interesting. But even though we laugh, is to tell you that it is serious. If you are a wife to this man, please show him true love by proposing possible solution. Speak to him in a very lovely way and then plead that you will take him to the hospital tomorrow. You will be the one to lead. This may just make the man rely on you, and that is why a woman should be in his life. Help him. If they discover the true cause, they will treat it and bring your man to action. Number 6, swelling or lump in the testicles or testicular area. Some women, you are the one who is seeing the nakedness of your husband when you both get back into your bedroom. Some of your men have swollen testes. Maybe you have a big, what we call hydrocele there. And you may even be wondering sometimes when even the testes inside are inflamed. And then you find it's like hernia again. Some even have the hernia itself, what we call hernia. We'll be explaining that in another video. And some will just have some kind of swelling and abnormality around there, and it even making him not able to have erection, and you are not complaining, and you don't even see it as a problem. No. Take it to the hospital. Number 7, a semen analysis, because sometimes you may just go to the lab and they collect the semen of the man, analyze it in the lab, and they may collect the semen. It may show that he has low sperm count, or he has azoospermia, or oligospermia. Oligospermia is a situation where the sperm cells is very scanty. In fact, it's a case of low sperm count. But azoospermia is a case of absence of sperm. Some man can have sex, ejaculate, and some you really see the ejaculate, like milk, like you see it looking quite voluminous. And some women say, no, my man, they really move water plenty. Some water like that, some discharge like that, some ejaculate like that has no sperm inside, not even one. It means that there is a problem. His testis is not producing sperm. Number 8, drainage or discharge from the penis. You notice that there is some discharge through your penis. Sometimes you wear your pants, and then you come back, you want to loosen it. The tip of the penis is sticky. It gums like that. Very sticky, and the pants may gum on your penis. You are trying to peel it, and it causes pain. It is secretion that has come out from your penis and caused it to gum, to stick like that to it. And some of this secretion is milky, and some may look yellowish, some may look brownish, some may even have odor. That tells you that I have serious infection. And if you're just looking at that, is that not a sign that there could be an infection that could render the man infertile? Number 9, small size testes. I say, sit down and touch, go to your scrotum between your legs. Touch. If the sizes of the testes are not reasonable, because they are not too big, they are not too small, and they are about the same size. They are about the same size. If you go and touch that small sac, and then you notice some small improper fractions inside, it means that your testes are too small, smaller than normal. That man cannot reproduce. But he may be having good erection and having sex. So some lady, they compare by the strength of their man during sex. Say, oh, my man is strong. If that one in the bed, don't try with my man. No, that's not what determines ability to get a woman pregnant. That's not what determines fertility. Are the testes fine? All right. Number 10. Undescended testes. Some testes, just go and touch that sac. That sac might be there, but there's no testes there. Sometimes even your wife will begin to touch it and notice that, no, the testes are not here. Oh, but the man has been having erection. Then he cannot reproduce. Number 11. Because that was 10 I just gave. Number 11, family history. You may marry somebody and notice that it like runs in their family. And like people in that family do not reproduce. They just marry anytime they don't have children. Then question mark. Find out. You and your man can go to hospital. If he is also at risk, they find what to do. The earlier the better. Number 12. Inability to get a woman pregnant after regular sexual intercourse for up to a period of 1 year or more. Some people are even living together, that they have sex at least 2 times. Another person asked me another day, how regular is sexual intercourse? At least 2 times per week. And runs like that. It means that somehow within 1-2 months, one of the times you meet is on a fertile period. That if a man begins to have irregular and until 1 year with a woman without ever seeing the fruit of the womb, suspect yourself. Number 13, premature ejaculation. There are some men that as soon as they have erection, the ejaculate is already flowing out. It's already flowing out. Some may even penetrate the vagina of the woman, but they may not even go 1 minute. The thing has already flown in. Wow, he has ejaculated. This, in most cases, indicates that there is a problem, and such problem always end up with poor quality sperms. Number 14, poor feeding, poor diet. Do you really check what you eat? Do you check what you eat? Because it is said that your food, will determine your health. Your food is your medicine. Do you eat balanced diet? Do you take enough fruits and vegetables? Quality feeding would even solve a problem of infertility. Number 15, I feel sad to say this point. Some women, they just leave the man in the house and they take another man outside, and the women feel comfortable anytime to meet another man outside, and the husband tolerates. Husband says, no, I don't have a problem. It's okay. Because he's even praying that you may go out like that and carry a pregnancy. So what is the sign here? You find a man that doesn't bother when the wife sleeps with another man. Is that not a sign of infertility? If you love our lesson, please subscribe to my channel. You can contact me on the number 674-6054-69. If you're out of Cameroon, start with the number +237. Thank you.